Joining me here in Studio A to talk a little bit about his job at San Juan Regional Medical Center now that he has a year and a few months under his belt. Jason Rounds is back with me this morning. Welcome back to KSJE, Mr. Rounds. Good to have you here.
Thank you for having me this morning, Scott.
You bet, you bet. As I mentioned, you've got about a year and 6 months under your belt, and so how are things going?
Really well. It's amazing. Time flies, so it seems like I just got here yesterday, and somehow it seems like I've been here forever at the same time.
Gotcha. But you've settled in, and your family has settled in, and you've kind of seen the ins and outs of the hospital. And of course, whenever we talk about healthcare, that is a constantly changing and evolving topic. And so, how San Juan Regional fits into that evolving topic is certainly cause for discussion as well. So that's another reason why I wanted to bring you in and talk with you this morning.
Absolutely.
Some other things the hospital's doing, of course, it is flu season, and so you've got some flu shot clinics planned, as you always do. The hospital always does every fall.
Absolutely, and thanks for bringing that up, Scott. So Saturday, October 26th, and Saturday, November 2nd, we're going to offer our drive-through flu shot clinic, as we've done in previous years. It's going to be in our parking lot at the corner of Maple and Schwartz. It's free of charge, as always, to adults 18 and over, and so it's going to be first come, first served until the vaccines are exhausted. So
okay.
Happy to provide that to our community as part of our support.
Very good, and they're pretty quick about that. You roll up your sleeve, roll down your window, and boom, boom, you're pretty much done.
We try to make it an efficient operation.
Yeah, very much so. So that's good to know. And again, I think it's always important for folks to get a flu shot. But we always say, if you're concerned, talk to your medical provider about any vaccination that you want to take or any inoculation you want to get, and they can answer your questions.
100%. We're great advocates for the flu vaccine. In addition to, if you are in the categories of 65 or older, or diabetic, or have other complicated immune systems, flu shot and the new COVID vaccine are great to get. Make sure that you keep you safe and your family safe over the winter.
Right, very true. And the local pharmacies, I guess, will be handing out or giving out the COVID updates too this fall. Is that the idea?
So, that's correct. So our local pharmacies are getting the new booster that's in. It's updated for the new variants that are out there. There are two that are currently out, the Pfizer and the Moderna, and I think there's one other that will be coming out, slightly different formulation later in the year.
Okay, all right, very good. Other topic I want to ask you about that we were talking about before we came on the air this morning involves finances and some legislation, I guess, that was passed recently that should be helpful to San Juan Regional Medical Center. And again, our hospital is somewhat unique in that it is a community hospital, nonprofit hospital that supports the community, but it's maybe a little different than other hospitals folks may be familiar with or hear about on the news, let's say.
No, 100%. So Albuquerque Journal recently published an article about the Healthcare Delivery and Access Act. So this was a bipartisan approach to help really provide a sustainable financing method for all of the hospitals in the state of New Mexico.
Large and small.
Large and small, rural, urban, the likewise.
Okay.
Now, the rural hospitals tend to benefit to a greater proportion, but everyone is kind of a winner in this scenario. So what it really does, the state law will assess a tax, and I hate to call it a tax because this was really voluntarily and done in collaboration with the state hospitals to come up with these funds that will provide for a federal match. So for every dollar that the state pools, it can bring down up to $3.72 of federal funding. And those funds are going to be distributed back to the hospital systems for the care of their patients.
Okay, seems like a good deal if I was paying $1 and getting more than $3 back.
Absolutely. And so this was a legislation that was currently available. These were dollars that were simply just not being drawn down by the state that were already eligible to.
Okay.
So in total, the state's going to draw down about another $1.5 billion to support the healthcare needs of our citizens. It's formulaic, so it's based on the number of Medicaid patients that are out there. There are quality metrics that a hospital doesn't get this pool of funds without having to hit certain quality
standards.
Right, okay. That will go through that. And the rural hospitals are going to benefit disproportionately better than perhaps the urban hospitals, and it kind of is graduated up there. For example, the rural hospitals on average are contributing or being assessed about 19% of the funds, and they're getting a return of about 40%.
Okay.
And it graduates up there. So the urban hospitals, the large systems are getting a little bit less. And we're somewhere in the middle. So for our community, it's going to be a tremendous benefit. We've been out beating the bushes, so to speak, telling people that this is coming, the magnitude of what the impact is going to be over the upcoming years, what we're going to have to do with it, and really challenging our board of directors in our community to really kind of get together and take a look at our strategic plan and what we need to do for the next 5 or 10 years to make sure we're making the most of it.
Got you. And I know funding is always a topic of discussion for your board and for you, and sustainable funding certainly as well, because again, as a community hospital, your mission is not to turn anyone away from care. Someone shows up on your doorstep, you're going to take care of them no matter what needs to be done, if they have insurance or no insurance or no money or what have you. And that falls, I guess, back on the hospital and also the county to fund some of that indigent care. But again, it's one of those ideas that no one should be turned away from getting health care.
Great. So yeah, absolutely. We take we're a sole community provider currently, and we take that role very seriously. And if you look at what's available around us, is we're kind of the only game in town, so to speak, for a vast area. So we are pleased that we provide certain services. We punch above our weight, so to speak. We have 3 neurosurgeons, for example, that
Right.
can provide trauma care. We have a rated level 3 trauma center to take care of those types of accidents. We have a flight service that flies into the 4-state area, transporting patients to our facility, and on those other occasions where higher level of service is needed, out of our facility as well.
Right.
So
And that's not cheap, pardon me for saying, but to have any kind of air service is pretty expensive commitment.
Absolutely. So, but it's something that we're proud to do in service of our community. And we have one of the busiest emergency air transport services in the country. So our planes and our helicopters are not sitting in the hangar, so to speak.
No, true. You're getting your money's worth, I would think. And I know, a lot of folks, when the idea of a helicopter ambulance was first proposed, were talking about, getting patients to the emergency department or to hospital within that golden hour or whatever the case may be, right, to start getting that care. And because we're such a rural area and the hospital covers such a vast part of geography, getting that patient back through the air quicker than on a road ambulance or driving is certainly really important for the outcome of their care, is what I'm trying to say. Not in a very clear way, but you know what I'm trying to say.
No, absolutely. That golden hour is actually paramount, and one of the key reasons of why we have such a well orchestrated ambulance service and air transport service. They work in concert with each other, and so there's always good communication between what is the best option for that patient in whatever circumstance they're facing.
Right. And for the community, I think, to understand too the basics of the hospital, being a nonprofit community hospital, which is somewhat different than, again, I think a lot of the other hospitals that we're seeing, maybe around the country, maybe around the state, if you will. It's unique in that you're not in the business to make a lot of money. You certainly want to pay your bills and pay your staff and keep the lights on and things like that, but really that's about it, is it not? And have some money for reinvestment, I guess, too.
Well, you've hit the key points here. So we are a private, not-for-profit, 501c3 organization. There is still some confusion, even within our community, that we're a county hospital, and that's just not the case. So we earn our money, we're invested locally, that investments go back into the community, support that, and if there are margins, so revenue above expenses, that money is invested back into the community. It's one of our missions for our organization to make sure that we're supporting the community appropriately. But we have the same business pressures that a lot of the private companies do. So if we are not earning our keep, so to speak, we are having those same pressures. There's not a big brother, so to speak, that's going to come in and necessarily bail us out. So
right.
It's something that we're very proud of.
Sure. Well, and again, recruitment is always something that is top of mind, I know, getting quality doctors here and staffing nurses and all the other folks that go along with that. We saw it during COVID, of course, but again, you mentioned the neurosurgeons that you have on staff. I know that the hospital spent a lot of money on heart care and cardiac care and things along that line as well, and there's other areas I know that I'm forgetting, but you're going to tell us about. But all that has been a big investment, too, to kind of be that center of care for this whole region.
Correct. So over the last years, we have been investing in technology, in our workforce development. Interestingly, the Healthcare Delivery and Access Act is going to help us do that even better. The whole point of that is to really provide additional funding to help bring more providers and caregivers to New Mexico and certainly to the Farmington area. So with that better funding, we'll be able to recruit. I'm knocking on wood because as we're really seeing a number of physicians and advanced practice providers leaving the state, so there is a net negative outflow than inflow. Over the last year, we have been successful in recruiting some really top-notch providers to our community. So before July, I'm trying to get the numbers right, I think we had recruited 26 new advanced practice providers and doctors to our community. And since July, we have over 22 committed now that will be coming on over the next year. So key specialties that we've struggled with to recruit, like OB, we've got 2 new providers that have signed on. We've recently just signed on 2 new GI doctors who are going to be providing hospitalist specific care for us, some of these high-level specialists, as well as primary care and the whole contingent. So we have about 38 positions that we're actively recruiting for now in advanced practice providers and physicians, as well as a large need for caregivers, from nurses through techs to rad techs to the whole thing. And we have some really innovative approaches, especially using some of this new money from the Healthcare Delivery and Access Act, to invest in the community. We're working in partnership with San Juan College right now.
Very good.
They've made a commitment to increase their nursing class by, I think they have 2 enrollments per year. They're increasing that number by 16 each time. So just looking for creative ways in those partnerships that we can invest in our workforce in this community.
Right, increasing that pipeline, I guess, right, from the college to San Juan Regional with these graduates, with these folks that are learning the skills that you need to have.
100%. So there is an undersupply of caregivers across the country. So this
Right.
is not unique to us. So really focusing on investing in the front end to make sure that we're getting the people who are going to be taking care of all of us as we get older in the mix. So if we were just counting on trying to find enough experienced providers who want to, caregivers who want to provide these services, there's just not enough out there. So we want to make sure that we're investing in the future.
Got you. And you mentioned that this is an issue that's happening not just across the state, but across the country. Is it a salary issue? Is it a benefits issue? Or is it just a person, not enough people issue? Do we know?
It really feels like it's a not enough people issue. And once again, there's lots of contributing forces in that. Is the compensation right? What's the market doing? Are there enough people out there? What are the motivations to do that? But I recently came from Arkansas, so I was with the UAMS system there, and they
Right.
have 2 nursing schools. But really working with those leaders as well, there was an initial kind of disconnect over the nature of the problem and trying to get enough folks in the chute to be able to provide that. So I think all over the country, my counterparts in markets that look like ours are doing what we're doing. They're working with local education systems to increase the reserve of folks that are available to come out there. So we're happy that we've had such a positive response from our friends at San Juan College.
Very good. Well, it's been a long-standing partnership, I know, between the hospital and the college, and it looks like it's growing and it's a mutually beneficial arrangement.
Absolutely. Over 50 years, our relationship. So
How about that?
Yeah.
Very good. That predates both of us.
I know.
Right, so there you are. Very good. Well, Mr. Rez, I want to ask you too a little bit about another healthcare facility that is being constructed not too far from where we're sitting right now, and they're calling themselves a community hospital, and some folks are saying, well, that may be a concern for San Juan, or what does that mean for San Juan Regional? What's your idea, or what's your reaction to that new facility coming online, I guess maybe sometime next year perhaps?
Sure. Well, basically my philosophy is competition is good. We've been here as a sole community provider for a long time, so it allows us to really kind of look at our delivery models, our systems, and what we're doing a little bit differently and kind of brush off the cobweb, so to speak. But as a community hospital, I would really encourage the listeners to go out and kind of research. This is a venture capital group out of Dallas. They have systems or facilities that look like this in Arizona and Texas and some other states. So it's unique, not quite unique, but almost unique in New Mexico. I think there's one other system in Albuquerque that looks like them, Albuquerque ED. I think they're building a second location. But they're really focused on a very narrow set of care.
Not going to be a cookie cutter of what San Juan Regional does.
Not at all. So they're going to have, I think, once again, they don't invite me to their planning session, so
Right.
forgive me if I don't get it quite right, but I believe they're going to have about 11-bay ED with a number of hospital beds that I think they'll use largely as an overnight observation opportunity for their patients.
So we'll have an emergency department with a few beds associated with that, and then some other maybe observation rooms for patients.
Correct. So,
But less than 25 or so, right? Or well, less than 50, I would think.
no, absolutely.
Not the-
I think
not
it's
the
gonna be
number of beds that
11,
you have,
so
which is in the-
18 or 19 beds is, I think, what they have published.
Okay.
And once again, I'm
Sure.
quoting unknowledgeable on that one.
Right. But compared to what San Juan Regional offers, you have how many beds at San Juan Regional Medical Center?
198 beds.
Okay.
We're really kind of focused on that critical care medicine aspect of it as we're shifting. We've got additional licensed critical care beds, really looking at the future and what is needed in this community. And we're also, with the need for healthcare in this community, it's hard to begrudge any new providers that are moving in here. So we're really looking to partner with them where it makes sense. In a lot of cases, by their own conversations with us, they expect about a third of the patients that are seen there are going to have to get higher level care someplace else. So in our partnership with the county, we run the ambulance service. We wanted to make sure that we were staffed appropriately to be able to do that. So we've added another crew and another ambulance to be able to support that. So if they're sending, as an example, 20 patients out of their system, either to our hospital, which we're happy to take those patients when needed, or out of the community, we want to make sure that we have the resources available to be able to do that.
Got you. And so you imagine that you will be a referral for their patients that need that higher level of care than what they're able to provide.
Correct. They, as I understand it, they will not be doing procedures. So if you need an appendectomy, for example, and they determine that you'll be transferred to another facility, we would like to be that facility. We want to make sure that we're keeping our community and our patients local.
Right.
If you have a heart attack and they determine that you're having a heart attack, you'll be transferred immediately to us to access our cath lab capabilities and the like. If you're having a stroke, for example, you'll be transferred to our facility. So those higher level needs, we want to make sure that we are supportive of and to keep our patients local.
Got it. Very good. And again, that is currently under construction. I don't think I've seen an opening date yet, but I know you're preparing for that, obviously, like a lot of other folks probably are too.
Absolutely. So they are scheduled to open in June, the last I heard. That was at the grand opening, and so that's what we're planning for. We're anticipating in our facility about a 20% drop in our ED volume. Once again, it'll be kind of probably a focused clientele that's navigating up there, and like I said, we want to make sure that we remain a viable option if they need higher level of care, and they can come back to us and get that.
Right. Understood.
In our normal San Juan way.
Right. You mentioned some new doctors that are coming in. Is there any concern about maybe a competition with this new facility, maybe with your doctors, or trying to cherry pick some of the staff that's already here to work for them?
Workforce is always a concern. I think our primary concern is with our caregivers. So it is so difficult to recruit to this community right now those well-trained, highly competent, experienced caregivers who are providing that service. So the ED is one of the critical areas for us. We're going to be recruiting from the same pool. And we're certainly concerned about if they're going to be able to draw out of our own hospital system. So we're paying close attention to that.
Okay. Is there such a thing as non-competes in the medical field for your staff and things like that when you sign somebody on?
Well, if actually there's lots of new legislation that's out there that's really limiting the ability for non-competes to be effective, and it's something that we traditionally really haven't focused on. We really feel that people should have the right to work where they feel is the best opportunity for them. We just want to make sure that they always think that we're that best opportunity.
Gotcha. Okay, fair enough. Appreciate the comments on that, and we'll see what happens, I guess, as we go closer to next summer.
Yep.
Again, the medical and the healthcare industry always seems to be evolving, as I mentioned, and we have the Affordable Care Act, and I think it's no question that a lot of people that didn't have healthcare or opportunities to access healthcare before the Affordable Affordable Care Act now do. Some folks still don't like it. Some folks do like it. That's a political thing that we won't get into on this program. But the idea of access to health care has got to be really important, and for folks to be able to maybe take more control of their health and to be able to manage their health has got to be a good thing. I mean, you see people at the hospital when maybe they're at their worst and they've got a lot of things going on that are wrong, that need to be fixed, or hopefully to get fixed. And if you can do more preventative care, that's got to be a good thing for the public. What a long question that was. I'm sorry about that.
Oh my gosh, I don't even know where to start on that
Feel
one.
free anywhere.
But as we're updating our strategic plan, one of the key elements that we're going to be talking about with our board and the community is access to primary care, and what that may mean in the future is. I just came back from a conference with my board members, and AI was a hot topic.
Oh,
so
sure.
the ability of how that can support you and what it can do or can't do. And you've got Amazon that's tiptoeing into primary care. I've got friends who use that system. We've got our own telemedicine program that we use in partnership at San Juan County to supplement our primary care that's available in this community. So I think there's so much innovation within that realm that it's going to be interesting to see what happens over the next 5 to 10 years with respect to that. But we remain emphatic that it's a continuum. So we want to be able to be part of it at the primary level of care all the way through the critical needs into long-term care and otherwise. So really looking at the needs of our community and our patients, and making sure that we're investing appropriately of keeping our folks close to home.
Gotcha. And I know the hospital has invested in a lot of new technologies, as you mentioned, with kind of virtual health care and things like that, and being able to see someone maybe virtually. Robotic surgeries are now taking place at San Juan Regional Medical Center on a fairly regular basis, I understand.
Absolutely. The demand for our robot, which was our first one, has really already outstripped its capacity.
Really?
So we're really looking at that. But it's been a critical game changer for our metabolic and bariatric program in managing weight loss. And so we're doing those procedures robotically. But it's really amazing. I'm long in the tooth these days, but when it first came out, it was really kind of narrowly focused around maybe urological procedures or the like, but general, heart, bariatric, the whole range of it, it's really quite amazing what you can do with it.
And the differences being, I guess, I'm sorry to interrupt you,
Oh,
but
no.
just the differences of having a robotic assistant. It's not the robot actually doing the surgery. It's still guided by a surgeon, but it's the preciseness, I guess, of some of the things that the minute instruments can do maybe a little bit better than a surgeon can do.
Well, it's just it's that resolution in there. And so once you develop those capabilities and those techniques, it really is a less invasive procedure.
I see.
To be able to do some of this. So the recovery tends to be quicker, so you're not in the hospital as long if it's an inpatient procedure, or recovery times if it's an outpatient procedure are better. So
But the surgeons are looking at a screen and seeing this very, very up close image of what's going on, and the robotic equipment, I guess, is doing the work that's guided by the surgeon.
Correct. And I think that's an oversimplification of it.
Well,
it's
leave it to the media.
No, I mean, but that's really it. It really is. It's an amazing procedure to watch. Certainly beyond my understanding and capabilities, but it's something that we're proud to bring here. The other thing, and this kills a CEO because we like the shiny robots and the new things that we can point at and see, we're also making substantive investment in the stuff you can't see. So our IT technology. So we've done a tremendous upgrade with our servers and switches and all of that. Some of the software systems we're looking carefully and how we're going to invest in the future. The stuff is really expensive and it's really important. And it's going to make the difference on how patients access care in the future. And so we want to make sure that we have an absolutely strong foundation in that. We're also taking a close look at our facility. We have an older part of the hospital that needs some love and attention, so to speak. So we're looking at kind of upgrading the electrical switches, the plumbing inside of it, the roofs, the stuff like that, to make sure that we're going to be turning over this facility in great shape to the next generation of leaders that come after us.
Right, right. Very good. That's really important as well. And I know, the hospital's been very progressive, I think, in energy. You've got a solar field,
Yep.
I think, not too far from the hospital, right, that provides some energy to the hospital, maybe helps in times of interruptions with the utilities and things like that.
It was a good start. So it's providing about 35% of our daily energy needs. We do not have the capability of storing that power.
Gotcha.
So from a contingency standpoint, it can help if our power went out, but usually if the sun is shining.
Right.
So, but that's part of our long-term kind of mitigation strategies. And is that working? Do we make additional investments in it? What other type of technologies do we need to have? But we've had such great support from the city on that, as well as our other partners, that our key needs right now are focusing kind of on those infrastructure, is some new switches, making sure our light bulbs and our electrical systems are the most energy efficient. We're
Right.
having great impact with that.
Gotcha. I can't imagine what your utility bill is every month. I don't even want to know.
They don't tell me.
Okay, very good. Understood. But it's a big facility, one of the major employers of San Juan County, and certainly an economic driver in San Juan County. And that's been some of the things that my guests about economic development have talked about, is being that kind of that location for medical services and things like that, which I think has been part of the reason for your investments in some of these things, is to attract patients for care who maybe live outside of this community but know that they can get quality care for unique services here and not have to travel to someplace even further away.
100%. So we really want to focus on what can be done safely and well in our community, and that's part of our strategic planning process. I'm so excited to be part of the Four Corners Economic Development
Right.
Group. I'm on the board of directors now. But I think where I'm excited is healthcare right now. I mean, if you look at just the boomers, the demand for healthcare over the next 20 years, we're kind of in a high demand opportunity for that. So healthcare is going to, predictably, from a market standpoint, be a relatively stable, recession-resistant industry. We've got things like the HDAA that's going to help us with some funding over the next few years. So it's a prime time. You have a foundation pillar that's a relatively stable economic driver in a community like Farmington that will help not only attract businesses because we are a comprehensive healthcare system, but also we're recruiting 38 physicians and advanced practice providers. We have about 160 other well-paid positions that we're recruiting for aggressively. So those same drivers to invest in broadband, to invest in housing markets, to find those opportunities to attract people here, then to leverage that diversified economy. I think it's a unique opportunity for us.
Right. Well, and a lot of work to recruit some retirees here too, which is those are those boomers you're talking about, I think, right? That
Absolutely.
May need your services.
No, it's inevitable. So really excited about the development out in San Juan Country Club area.
Yeah.
So that's exciting, but healthcare is going to be such a foundational part of that. If we did not have a robust healthcare system in there, it would be difficult to retain those retirees for our community, make sure that we could take great care of them.
Right, very true. Another thing that the hospital is a leader in, I think, too, that is unique in the area is the cancer center. And those aren't cheap either, to make sure that that equipment is up to date and you're looking at the latest and newest technology, and again, to treat cancers and things like that. I think a lot of folks are surprised that a community of our size has a cancer center and can offer that to patients from the region. Again, that is something else that the hospital, I know, is very proud of.
Absolutely, and thanks for bringing that up, Scott. As we've recently done our community needs assessment, we do it every 3 years as a not-for-profit. One of the key areas that we recognize that we should be investing more in is oncology care. So in partnership and how we would do that. We have a phenomenal radiation therapy program. A great doctor, Dr. Fuller, who's joined us recently. The advanced technology and a wonderful environment to receive that care. We work very well with our independent group of medical oncologists that are in this community, but if we really look at the needs surrounding our community, we need to do more. So one of the projects that we'll be talking about at our upcoming strategy session is what type of investment and what do we want cancer care to look like for our community in the future. So it's something that I'm super excited about. I think it's something that could really be a cornerstone of what we invest in going forward.
Gotcha. Well, sounds like we're going to have you back, Mr. Rounds, to talk about that. And
Anytime.
and again, I think we can all agree that thanks to the community for another successful cancer walkathon
Yep.
that happened a couple of weeks ago. And so congratulations on that. I know that money stays local, which a lot of folks like, and support the Conley Hospitality House, which is certainly connected to the Cancer Center.
No, wonderful program, wonderful organization. Thanks to Audra Winters for coordinating that. It was an amazing event.
Very true, very true. Jason Rounds, we're out of time, I'm sorry to say, but I appreciate you coming in. It's always great to catch up with you, sir.
It's my pleasure. Thank you for having me.
Thanks for being here. That's Jason Rounds, CEO, San Juan Regional Medical Center, my guest here on KSJE.